the therapies for mantle cell lymphoma evolve, but the unmet clinical need also evolve. Let me tell you, when we relied on the chemotherapy, when the patient become chemotherapy resistant, what do? We used to use chemo-free therapies. So the urgent need was the chemo-resistant patients population. Then we found a targeted therapy, chemo-free therapies, and then we found some patients continue to relapse after chemotherapy and chemo-free therapy. So the urgent unmet clinical need is this high-risk patients who are resistant to chemo or chemo-free therapies. So we're using cell therapies. We're using cell therapies to combat the high-risk patient after chemo-free therapy. Now we can see that the majority of the patient with a CAR T therapy will eventually relapse. So the current urgent unmet clinical need is those patients who are relapsed after resistant to, who relapsed after chemotherapy, chemo-free therapy, and CAR T therapy. So you can see the unmet clinical need also evolve together with the advances of the therapies. So in my opinion, precision medicine will answer the unmet clinical needs after chemo-free therapy, chemotherapy, CAR T cell therapies. And that's so the future, the reality is evolving, the future is also evolving. That's the nature of the nature of the nature.